we'll start.
Order, order. I call Navinda Mishra to move the motion.
Thank you, Sir Christopher. It's a pleasure to serve under your chairship. Can I also thank the Honourable Member for Glasgow Central? I know she is covering front bench duties, but she was very kind enough to sponsor the application for this debate to the Backbench Business Committee with me. And I know she's a long-standing champion for public services and better healthcare provision for all. I'm also grateful to several organisations, including charities, that have helped me with this speech. British Liver Trust, we have several representatives from British Liver Trust here. Liver Cancer UK, the Roger Williams Institute for Hepatology, and Alcohol Change UK have also been quite good. I have met them in the past, not recently, but they've been long-standing campaigners on this issue. Before I start the main points of my speech, Sir Christopher, can I just pay tribute to Bob Blizzard, who's a former Member of Parliament, a Labour MP in Norfolk, and he did a lot of work in this House on Hunting Act and fought for animal rights. His family have been in touch and they wanted me to mention him. Sadly, he passed away in 2022 with a very rare form of cancer. He was diagnosed in December 2020 with this form of cancer, and they wanted me to mention the work of the Alan Mormont Memorial Foundation, who help patients and healthcare workers. I'll start with the key points of my debate, Sir Christopher. This is an important debate on health inequalities in liver disease and liver cancer. Is particularly timely with shocking new data that has been released this month that shows we are facing the worst mortality and hospital admissions rate for liver disease in a generation. 90% of liver disease is preventable, and if diagnosed at an early stage, damage can often be reversed and the liver can fully recover. But tragically, premature deaths from liver disease have surged to the highest levels in decades, and hospital admissions due to liver disease have risen by almost 80% over the last decade alone. This is driven by obesity, alcohol, and viral hepatitis. We have seen over a decade of cuts under the government. Successive Conservative governments have neglected patients and failed to take liver disease seriously. Our most marginalised communities, most at risk of liver disease, have been silenced, overlooked, and left behind. The liver disease crisis is almost entirely preventable and reflects a decade of decline in our nation's health, widening health inequalities and worsening life expectancy. Geographic inequalities in health outcomes for patients are stark, and north of England is disproportionately impacted, accounting for over a third of premature deaths in liver disease in 2022, 3,728. New data from the Office for Health Improvement and Disparities highlights that the North West, my own region, Sir Christopher, has the highest mortality rate for liver disease in the country, 35%, Sir Christopher, higher than the national average. The healthy life expectancy in Blackpool is now the same as in Angola, which is 54.5 years. The current government have failed to deliver on the Manifesto Pledge and Levelling Up mission to narrow the gap in healthy life expectancy. They scrapped the promised white paper on health disparities, repeatedly cut the public health grant, and have effectively decimated the Office for Health Improvement and Disparities. They've also overlooked liver disease entirely in their major condition strategy and U-turned on their commitment to roll out non-invasive liver scans to 100 community diagnostic centres. Our nation's liver disease is faltering and it's costing lives and piling on huge avoidable pressure on our NHS. Thousands of people die unnecessarily without access to specialist care because liver services are consistently overlooked and under-resourced. Risk factors such as obesity, viral hepatitis and alcohol are most prevalent in our most disadvantaged communities, with mortality rates from liver disease now 4 times higher in our most deprived communities compared to most affluent. I'll be happy to give way. Yeah.
For giving way and congratulate both colleagues on successfully getting this debate. Would you agree with me that there's a wider expectation amongst society now that where serious conditions occur, that there is an improving mortality rates that need to be shown in the 21st century? And the very concerning issue about here is that there is a worsening mortality rates, as he has quite correctly outlined, and that's something we all need to address as a matter of urgency.
I thank the Honourable Member for the intervention, and he's making an important point. As one of the most advanced economies in the world, we do expect our population to have the best healthcare, and we want to see life expectancy increasing for everyone, not just in certain postcodes. I do agree with him and thank him for the intervention. Sir Christopher, can I just add that almost 2/3 of adults are overweight or obese, and up to 4 in 10 children with obesity, that's 38%, are estimated to have early-stage fatty liver disease. Deaths due to alcohol-related liver disease in England have increased by 87% over the last 2 decades due to a rise in harmful and hazardous drinking. The cost of living crisis is exacerbating inequalities and risk factors facing vulnerable families in deprived areas with cheap junk food and high-strength alcohol that is widely available. It is estimated that over 206,000 people are living with chronic hepatitis B in England, the majority undiagnosed and unlinked to care. Undetected, it can lead to cirrhosis, liver cancer, and premature death caused by liver failure. Liver disease is a silent killer that is often asymptomatic in early stages. Shockingly, 3/4 of cirrhosis patients are diagnosed in hospital when the damage is irreversible and it's too late for effective treatment or intervention. The impact of late diagnosis and crisis point hospital admissions on our already overstretched NHS frontline services is pushing the hepatology workforce to breaking point, yet pressures are projected to increase at pace. My own constituents are at the sharp end of this public health emergency. In Stockport, premature mortality rate for liver disease in women has surged by 80% since the pandemic between 2020, which was 12.5 per 100,000, and 2022, 22.5% per 100,000. The overall premature mortality rate from liver disease between 2020 to 2022, that's a 3-year range, was 16.5% higher than the national average in Stockport. I was greatly concerned to learn that the British Liver Trust's recent Love Your Liver roadshow visit to Stockport last year identified that 1 in 4 members of the public had elevated fibroscan readings indicative of liver damage. Ethnic minorities, Sir Christopher, are also disproportionately impacted by liver disease. South Asian populations are particularly vulnerable to fatty liver disease due to genetic and socio-cultural factors, while migrants from countries where hepatitis B is endemic are at a higher risk of developing liver cancer. Liver disease patients also face stigma and misconceptions, which is hampering earlier detection and costing lives. Liver disease and liver cancer continue to be falsely labelled as self-inflicted, despite being linked to poverty and social deprivation. Almost half of patients with a liver condition have experienced stigma from healthcare professionals based on recent surveys from the British Liver Trust. Everyone at risk of liver disease and cancer should have equal access to faster diagnosis no matter where they live. Accelerating early diagnosis is pivotal to tackling health inequalities and narrowing the gap in healthy life expectancy. Yet new research by the British Liver Trust shows that fewer than 1 in 5 integrated care systems in England currently have fully effective pathways in place for early detection and management of liver disease. Alarmingly, my local ICS, Greater Manchester ICS, reported the highest premature mortality rate for liver disease in the country, but it is yet to implement an optimal pathway. The evidence is overwhelming, Sir Christopher. We can and must do more to support liver disease and liver cancer patients across the UK. The next Labour government will have a relentless focus on prevention and earlier diagnosis to turn the tide on this epidemic of preventable deaths. When the Labour government first asked Professor Marmot, when the former Labour government, I should add, first asked Professor Marmot to review health inequalities, then Prime Minister Gordon Brown said, the health inequalities we're talking about are not only unjust, condemning millions of men, women and children to avoidable ill health. They also limit the development and prosperity of communities, whole nations and even continents. Since then, we've had over a decade of austerity and deep cuts to public health, which have caused improvements in life expectancy to slow and even reverse. Health inequalities are widening and a growing number of people live for a greater proportion of their life in ill health. We need to look upstream, which is why the next Labour government is committed to taking bold action to halt the promotion of junk food, high in fat, salt and sugar targeted at children. We also need to talk about early detection. To build the NHS fit for the future, Labour is committed to hitting all NHS cancer waiting time and early diagnosis targets within 5 years. Recently, Sir Christopher, I have tabled a number of written parliamentary questions on this matter, and the answers do not fill me with confidence when it comes to the care and the health care that my constituents are receiving. We also need to accelerate early detection by doubling the number of CT and MRI scanners in hospitals in England. I urge the Minister to mirror this upstream focus on early detection by committing to sustainable funding for new technology to improve early detection of liver disease in primary and community care in the next spending review. I also call on the Minister to introduce a new nationally endorsed pathology pathway to improve early diagnosis of liver disease and ensure every community diagnostic centre has an assessment for fibrosis. Liver cancer is the fastest rising cause of cancer death in the UK. As one of the 6 less survivable cancers, it has a shockingly poor 5-year survival rate of just 13%. Yet public awareness remains very low, with liver cancer patients overwhelmingly diagnosed at a later stage. Outcomes for many types of cancer have seen huge improvements over the recent decades, yet deaths from liver cancer in the UK have increased by 40% in the last decade alone, hampered by lack of funding, research and innovation. I'm just coming to the end of my speech, Sir Christopher. I just wanted to mention a couple of staggering points that have been provided to me by Alcohol Change UK. And sadly, it's a fact that harm caused by alcohol is on the rise. The pandemic has had a serious impact on alcohol consumption in England, with people drinking at harmful levels increasing their drinking. 1 in 5 people in the UK, 1 in 5, are drinking above the recommended weekly amount, and many want to cut down. Alcohol causes the majority of liver disease, and drinking alcohol increases the risk of liver cancer. Alcohol has become the leading risk factor for death and ill health amongst those aged 15 to 49 in England. And Alcohol UK found that only this week that alcohol-specific deaths in the UK are worst on record, 32.8% higher. 32.8% higher than in 2019. In 2022, 76% of alcohol-specific deaths were caused by liver disease. So this is an extremely serious topic. I'm grateful to the Backbench Business Committee for allocating time for this debate, and I'm grateful to everyone who's turned up in the visitors gallery, but also the Backbench MPs who've come up to support this debate. Thank you, Sir Christopher.
The question is that this House has considered health inequalities in liver disease and liver cancer. Kirsten Oswald.
Thank you very much, Sir Christopher. It's a pleasure to serve under your chairship. And I'm grateful to the honourable members for Stockport and Glasgow Central for securing this important debate on health inequalities in liver disease and liver cancer. I think it's a particularly timely debate given the recent publication of statistics showing that alcohol deaths in the UK surged during the COVID-19 pandemic. And while alcohol misuse isn't the only cause of liver disease, it is, as we've heard, responsible for a large proportion of cases, and this does need to be addressed. As the honourable member for Stockport set out, we need to acknowledge that liver disease has an inescapable link to deprivation. The incidence of liver disease and the risk of hospitalisation and death are all significantly higher in regions and nations of the UK which have higher levels of deprivation relative to London and the south east of England. So it is important that we discuss this. It's welcome to have a debate on this topic today, and we should do this from the starting point that deprivation leads to poorer health outcomes. In the case of liver disease and liver cancer, that means that you're 4 times more likely to die if you are from the most deprived area compared to someone from a more affluent area, and that is not acceptable. It is now conventional wisdom that preventing a disease is far more desirable than having to treat or cure it. In Scotland, we have rates of liver disease which are far too high. However, I'm grateful that the Scottish Government has introduced policies which are making a real difference in reducing deprivation, decreasing the incidence of liver disease and improving early detection. And the Scottish Government, looking at this in the broadest sense, has introduced policies such as the Scottish Child Payment, which is described as a game changer by anti-poverty charities, and combined with other interventions, this does have the potential to lift an estimated 100,000 children out of poverty. That investment is just one example of the Scottish Government intervening at the early stages of life to reduce inequality, and it will undoubtedly help in our fight against conditions including liver disease and indeed all the other diseases which are so associated with inequality and deprivation. The introduction of minimum unit pricing in Scotland has also delivered results. In England, where there is no minimum unit pricing, liver disease mortality and morbidity continue to rise, whereas in Scotland health inequalities are gradually decreasing. This has resulted in chronic liver disease deaths in Scotland decreasing from 17.9 per 100,000 in 2021 to 17.4 per 100,000 in 2022. And let me be clear, these figures are still very stark. More action is absolutely needed, but minimum unit pricing has reduced alcohol-related harms and alcohol-specific deaths by 13.4%. That's surely an intervention that we should now be seeing across the whole of the UK to help tackle liver disease, amongst other issues. We've also seen Scotland's innovative life sciences sector produce groundbreaking tests to help diagnose liver disease at earlier stages when damage can be reversed and the progression to cirrhosis or cancer halted. Unfortunately, the reality, as we've heard, is that 3 in 4 liver disease patients present at crisis point, usually in A&E with cirrhosis and all the horrible symptoms which come with that condition. Researchers from the University of Dundee have developed the new Intelligent Liver Function Test, which uses an algorithm to perform additional investigations on abnormal blood test results. And that new test can help refer patients to specialists earlier than would otherwise be the case, minimising the workload of GPs in primary care and increasing the diagnostic rate of liver disease threefold. It does have the potential to revolutionise the diagnostic pathway. Focusing on tackling the misuse of alcohol, obesity and the prevalence of viral hepatitis are all important to lowering the rate of liver disease and liver cancer. But we can't escape the fact that the current UK government's decision to oppose more to the current UK government's decision to inflict more than a decade of austerity has exacerbated the inequalities and deprivation which are associated with liver disease. If the UK government wants to get serious about tackling liver disease, then it needs also to get serious about tackling inequality. Threatening to cut the benefits of disabled people who are unable to work does nothing to tackle inequality. Forcing real-term cuts on departmental budgets already strained due to inflation does not deliver the services needed to tackle inequality. Indeed, the UK has one of the highest levels of regional inequality in Europe, and until there is a real and concerted effort to change this basic fact, then unfortunately the poorer outcomes for liver disease and liver cancer, particularly among the most deprived communities, will remain stubbornly hard to improve, and I hope that we'll hear today on action that the UK government is willing to take to ensure that that is a statistic which becomes a thing of the past very quickly.
Aaron Hodgson.
Thank you very much, Sir Christopher. It's a pleasure to serve under your chairmanship today. I want to start by thanking the honourable members for Stockport and Glasgow Central for securing this important debate and for the excellent opening speeches setting the scene also. Addressing liver disease and cancer has for far too long been put on the back burner. Despite the vital work of organisations like the British Liver Trust and Liver Cancer UK, liver disease remains a leading cause of premature death and is now the fastest rising cause of cancer death in the UK. Yet 90% of liver disease is preventable and is in many cases reversible. It is a travesty and indictment of the state of our healthcare system that 3/4 of people living in the UK are diagnosed when it is too late for effective intervention or treatment. I'm acutely aware of the effect that liver disease has because Washington and Sunderland West is at the heart of this public health crisis, which disproportionately affects those living in the North East. In Sunderland, hospital admission rates due to liver disease were shockingly 84% higher than the national average in 22-23, with the region suffering one of the worst hospital admission rates in England for women with liver disease. And we see the hand of inequality stretch even further, as over a third of all premature deaths reported in 2022 were in the north of England, despite the government's manifesto pledge that levelling up mission to narrow the gap in healthy life expectancy. The government's inaction towards tackling health inequality is clearly indicated by the simple fact that since the Marmot Review was published in 2010, health inequalities have widened. If we are to tackle this, then we must start finally tackling the root causes of this issue. We must reform our approach to liver disease and cancer, no longer allowing the prevailing myths of it being self-inflicted, as my honourable friend for Stockport said in his opening speech, to impact policy decisions when we know the fatal consequences of the status quo. Despite hospital admissions caused by liver disease having risen by almost 80% over the last decade, liver disease was omitted from the major conditions strategy and overlooked in the core modalities for community diagnostic centres. We owe it to all those affected by liver disease to set out a proper plan to improve diagnosis and treatment. We must take a holistic approach to this, focusing on improving every area from research to prevention to treatment. And I believe the creation of a new nationally endorsed diagnostic pathway would be key to ensuring there is earlier diagnosis with less regional disparity. In the short term, I urge ministers to deliver a prompt and comprehensive review of adult liver services by NHS England and to ensure that local health commissioners learn from areas where fully effective pathways for early detection and management of liver disease are already in place. We must no longer ignore the simple truth that we cannot improve outcomes for liver disease and cancer if the staffing crisis, long waiting times for diagnosis and the barriers to accessing specialist care once diagnosed continue. We are seeing it with liver disease where the crossover of specialist services means those affected experience pressures on the NHS acutely, but the same story is being told in every aspect of healthcare. We must deliver more scans and more appointments every year. If we are to catch cancer early, and then I'm pleased that Labour has committed to a £171 million a year investment to provide the NHS with state-of-the-art equipment and new technology to cut these waiting times and speed up diagnosis and treatment. I very much hope that we can take momentum forward from this debate and push the government to finally implement measures to increase diagnostic raises, invest in preventative measures and improve treatment for liver disease and cancer, because those seeking treatment cannot afford for us not to. Thank you.
Alison Thulis.
It's a pleasure to see you in the chair, and I'm very grateful to the British Liver Trust for the very comprehensive briefings and support that they have given me for this debate, and also AMMF, the cholangiocarcinoma charity, who have also provided a very helpful briefing on liver cancer as well, which was really useful. The reason that I've come to speak in this debate, and quite often I don't come to speak in debates about health matters because those are devolved to the Scottish Parliament, but I do have a personal link to this. My husband Joe was diagnosed with non-alcoholic fatty liver disease at stage 2 in 2019, and he had put in significant efforts to deal with that condition, because it is, when caught at that stage, a reversible condition. And like many men, didn't go to the doctors for far, far too long and had that diagnosis when he finally did go to get that checked out. But he's been quite clear that it is very challenging in order to try and to tackle this as an issue. You have to kind of consciously do an awful lot more to keep yourself healthy, because we do live in a very obesogenic environment, a very alcohol-focused environment. So the things that can tempt you back into bad habits are always there. And he continues to go on with that challenge. And he also has talked about the issue of stigma around this as well, which is absolutely true. And almost 3/4 of people with a liver condition have experienced stigma, and almost a third feel that that stigma has stopped them from receiving medical care, because quite often that stigma comes from liver disease's association with alcohol misuse and with viral hepatitis. And we must do everything that we can to bust that stigma and to make sure that people go and get the treatment that they require as soon as possible, rather than putting it off, because the risks of doing so are very, very serious. And I also want to make a small mention, when we're talking about stigma as well, about the read across to the contaminated blood scandal also, because there is a direct read across to that for hepatitis C and those who were infected with that. particularly those that didn't know that they had been infected because of the subsequent cover-up of their medical records, and some of them didn't find out until serious damage had been done to their livers. And for some, sadly, it came too late. And I've heard stories at the all-party group on contaminated blood of people whose death certificates have been put down to chronic alcoholism when in fact they'd never touched a drink. So there is a real issue of stigma around liver issues, which we must do our very best to try and bust. But it is very much a public health emergency. It is something that the government ought to be taking very, very seriously indeed. Liver disease and liver cancer continues to be a very significant issue in Scotland. Liver disease is one of the leading causes of premature deaths in Scotland, above breast cancer and suicide. And deaths due to chronic liver disease in Scotland have increased by 85% in the last 3 decades. And there has been an impact, of course, during the pandemic, as well, as the Honourable Member for Stockport and the Honourable Member for East Renfrewshire also mentioned. And I think that speaks a little bit to the alcohol aspect of this and the alcohol culture that we are all soaked upon. I mean, how many people have heard the phrase wine o'clock? It's been minimised, it has been reduced to not really mattering at all, but that alcohol culture leads people into very harmful habits. Society downplays that, and I was very glad to see the Scottish Government response to some of this alcohol culture being in minimum unit pricing, because minimum unit pricing has reduced consumption of alcohol in Scotland by 3%, reducing deaths wholly attributable to alcohol by 13.4%, and reducing hospital admissions due to alcohol from chronic causes, such as alcoholic liver disease, by 4.1%. Alcohol-specific deaths have risen more slowly in Scotland than in England, highlighting that the situation could have been much worse had Scotland not taken the bold step to introduce minimum unit pricing. And of course, it's got the greatest harm reduction impact among more deprived groups in Scotland as well. So it has that important protective factor. And I would ask the Minister, when she responds, to say whether she would consider bringing in some kind of aspect of minimum unit pricing in England, because the small weakness of this is that minimum unit pricing does put those profits back into the hands of those selling the alcohol, because we don't have full control over the taxation system for alcohol in Scotland. It would be incredibly useful if we had all of those powers in Scotland to do that, but were there an intervention in England, that might be an opportunity to do that. Because removing the duty escalator in alcohol has meant that alcohol has relatively got cheaper. I also wanted to mention some of the work that has been happening in Scotland, because Scotland is showing signals of incremental improvement through the Scottish Government's focus on prevention and earlier diagnosis. And that same progress has not been seen in England, where liver disease mortality rates are at their highest level in decades, and hospital admissions for liver disease have risen by almost 80% over the last decade alone. In Scotland, by comparison, liver disease death rates have decreased between 17.9 per 100,000 to 17.4 per 100,000 between 2021 and 22, and hospital admissions caused by liver disease have also decreased by 1.5% between 2022-23 and 2021-22. And in my own health board area, Greater Glasgow and Clyde, it has seen the largest fall in chronic liver disease death rates, which is really quite impressive given the health challenges that we have faced. And I think that is quite significant. And I was struck when the British Liver Trust's Love Your Liver roadshow was on Argyll Street in my constituency, the number of people that were quite interested in this as well. I mean, Glaswegians are a very curious bunch. You can't do anything without somebody asking a question and stopping to find out what's going on. But people were like, oh, a liver test, I'll queue up, I'll queue up and I will wait for my liver test in a van in the middle of the city centre. And around 100 people were scanned that afternoon, and 15 of my constituents were later given a referral for their GP as a result of that. So there needs to be more testing and more encouragement of people to go forward and check about this. And I think it is really quite important. And that non-invasive screening in a community setting is a life-saving intervention. We should make no bones about that. People should be able to access that at a very simple community level. And I'm sure many colleagues in this place will also have had their liver scanned when they've been in Parliament to do the same, which is really welcome. That FibroScan reading has been quite reassuring in a lot of ways that you can go and get that done, although with the propensity of health charities to come in and do tests on MPs, I'm fairly sure they'll find something wrong with me at some stage. But it is very welcome and very important that people feel that they can go for tests and that there isn't a stigma in doing so. So there has been progress in Scotland, and the intelligent liver function testing pathway developed by the University of Dundee uses an automated algorithm-based system to further investigate abnormal liver test functions and results based on initial blood samples from primary care. So there is development further on here as well that's happening in Dundee. And it is important that that happens. And the technology is cost-saving also to the NHS, which I'm sure the Minister would be interested in hearing, by over £3,000 a patient. So it is quite significant. And that is now rolling out and being piloted in parts of England also. I wanted just to touch a little bit more on what my honourable friend said about austerity and the impact that this has had on public health. And the Glasgow Centre for Population Health in my constituency have done a lot of research into this over the years. And they say that the years of Tory austerity have cost people dearly, not just in the damage that it's done to public health services, but to people and their life outcomes as well. My honourable friend was quite correct to point about further cuts to social security for people from the Westminster Government, because that makes it more difficult for people to make good and healthy choices in the foods that they buy and in the lifestyles that they have. And the Glasgow Centre for Population Health has said that just to get us back to where we were in 2010 will take another decade. That is 20 lost years of people's good health. That will have a significant impact for a very, very long time to come. I will do.
She's making an excellent speech. We already know that people who live in lower income areas, in more deprived areas, have lower life expectancy than people who live in perhaps more wealthy areas. The data tells us that, from Alcohol Change UK, that people from more economically deprived groups experience higher rates of liver cancer and are less likely to receive treatment. There are also higher rates of liver cancer among people from Asian and Black African backgrounds compared to those from white backgrounds. So this sort of tells us that people who have lower income or live in more deprived areas will die sooner. And it seems to me that the point she's making about austerity, the government hasn't done enough in the last 14 years to address these issues. Does she agree with me?
I absolutely agree with him, and I see that very much from the very varied communities that I represent as well. And it seems quite baffling to me that the Marmot's findings more recently have come as a bit of a surprise to some in government, because I remember at high school doing modern studies and learning about the Black Report and learning about the inverse care law, and it feels as though this government is no further forward. In fact, in some respects, much further back in tackling these health inequalities that are long-lasting. And to talk a little bit about the kind of public health aspects of this as well, the Scottish Government are currently consulting on advertising restrictions on food and drinks high in fat, salt and sugar, which again are disproportionately marketed towards children and vulnerable groups, and also found in poorer areas where that marketing and the lack of availability of fresh fruit and vegetables is often found. And this is significant because 1 in 4 children with obesity are estimated to now have fatty liver disease. That is a huge implications for their health, for their well-being for the future. It's caused by an accumulation of harmful fat in the liver, and it's present in around 70% of people who are overweight and obese. And fatty liver disease and excess weight together significantly increase the risk of premature death due to cardiovascular disease, a range of cancers including liver, colon, breast, prostate, lung and pancreatic cancers. But while Scotland tries to do our best within the devolved settlement that we have on this, a number of key commitments from the UK government to curb childhood obesity are yet, sadly, to be implemented, including the 9pm watershed plans to protect children from junk food advertising on TV, and the ban on multi-buy junk food deals. And we have brought in some of these things in Scotland where we can do. It does make a small difference, but there's an awful lot more that needs to be done here, and particularly for those in those younger age groups as well. They are being targeted with all kinds of multiple snack-type foods for children, which are largely unnecessary. But both Labour and the Tories need to stand up to these multinational companies who wish to push these foods on our young people. They are not; these things do not come cost-free, certainly not to society. So I want to just ask the government, will they build on the simple and cost-effective diagnostic pathways already in place across the devolved nations? Will they commit to sustainable funding for new technology to improve earlier detection of liver disease in the next spending review? Because that early intervention, that technology that can stop people before things get worse is really significant. Will they also introduce a new nationally endorsed pathway to improve early diagnosis? And will they ensure that every community diagnostic centre can have an assessment for fibrosis? All of these things will help to improve this public health emergency that we have. It's important that people have come here today to discuss this, but I do very much hope that the Minister will be listening, will make the changes that she can do, and that the Labour front bench also, should they be the next government, make sure that they take this seriously as well, because both on the alcohol-soaked and the obesogenic society that we have, both of these are really fundamental challenges that government should be intervening on to prevent the next generation of people developing liver disease and developing liver cancer. This is something that we can prevent if the public health imperative is there. Thank you.
Reid Corgill.
Thank you, Sir Christopher, and it's a pleasure to serve under your chairship. Can I thank the honourable members for Glasgow Central and Stockport for securing this debate, and my honourable friend for Glasgow Central sharing her personal experiences. I know that they are both great champions for improving health outcomes for all, and I'm grateful to them for bringing this debate to discuss a neglected but major killer. I also want to thank my honourable friend for the member for Washington and Sunderland West, sharing shocking figures of liver disease in her constituency. And as the honourable member for Stockport highlighted, new data released this month shows that we are facing the worst mortality and hospital admission rates for liver disease in a generation. Over 17,000 people die of liver disease and liver cancer each year, almost half among people of working age, that's age 15 to 64, at a huge cost to the NHS and the economy. And we've heard from members that 90% of liver disease is preventable, and if diagnosed at an early stage, damage can often be reversed and the liver can fully recover. It is an avoidable epidemic that is being driven by obesity, alcohol and viral hepatitis. And all of these issues increase in prevalence in the most deprived communities and drive health inequalities that we are here debating today. So this debate is timely because it comes in a week that we have received the sobering news that annual figures for alcohol-specific deaths have passed 10,000 for the first time ever. 76% of those were from liver disease, including liver cancer, but it is the third year in a row that deaths have risen across the United Kingdom, breaking previous records each time. And the rise was not inevitable, and it cannot be explained away as the product of the pandemic. It is a policy failure, and ministers today must answer for it. Outcomes for many types of cancer have seen huge improvements over recent decades, but as we've heard today, deaths from liver cancer in the United Kingdom have increased by 40% in the last decade alone. And it is the fastest rising cause of cancer death in the United Kingdom. And again, we've heard today, it's got a shockingly poor 5-year survival rate of just 13%. And public awareness remains very low with liver cancer patients, overwhelmingly diagnosed at a late stage. To her credit, the Honourable Member for Faversham and Mid-Kent recognised this when she committed in a letter to the Chief Executive of the British Liver Trust that the government would make fibroscans available for use at 100 community diagnostic centres by March 2025. Now, I have used one of these fibroscans, and they are a fantastic piece of kit which can tell you whether you have liver damage or early signs of liver disease. So why is it that in answer to my parliamentary question that I received in February, the Minister said that the government has plans for fibroscans not at 100 diagnostic centres, but only 12 as at the end of March? What about the other 88? It is all very well the NHS announcing funding for a new diagnostic pathway, but without the kit in local communities, how will that actually work? How and where will patients access scans and tests? Will they be available in the most deprived communities, where outcomes are far worse? And what about in GP practices or in pharmacies? Perhaps the Minister could take up Labour's fully costed plan for a Fit for the Future fund to double the number of MRI and CT scanners so that we can catch illness earlier, treat it faster before it's too late. To tackle health inequalities, we have got to get serious about public health and a prevention-first approach. Under this government, for the first time in a century, life expectancy has dropped in England, and a growing number of people live more and more of their life in ill health. And while this decline affects us all, Again, we've heard this from many members. It is not spread equally across the country. Over a third of all premature deaths were reported in the north of England in 2022. And in my city of Birmingham, life expectancy has dropped by nearly 2 years in just 3 years. And in Blackpool, you are 3 times more likely to die from chronic liver disease compared to the rest of England. And in parts of that town, life expectancy for men is just 2 years older than the retirement age. But what do you expect when the Prime Minister boasted about changing funding formulas to take money away from deprived urban areas? So, Christopher, as I mentioned earlier, alcohol consumption alone caused over 7,500 untimely deaths from liver disease in 2022, and those mortality figures have risen 3 years in a row. Yet, faced with this, the government has taken the decision to dismantle the central public health function. And as far as I can tell from the non-answer I received to written questions on this, they have abolished the Department of Health and Social Care's alcohol policy team. So can the Minister confirm, if this is the case, that there are no dedicated alcohol specialists in OHID and that team has now been redeployed? Should we take this as an indication of how much ministers care about this issue? And does that actually help us understand why there was no real terms increase to the public health grant in the spending review in March, even as alcohol treatment services have been hollowed over the last 14 years? So, Christopher, it does not bode well for the prevention strategy that the Health Secretary has promised before the summer recess. Hopefully it doesn't go the same way as the major condition strategy and the health disparities white paper before that. But I am encouraged to hear that measures to tackle the obesity epidemic should feature in that, if not alcohol. Fatty liver disease and excess weight significantly increase the risk of premature death due to not just liver cancer, but colon, breast, prostate, lung, pancreatic cancers, and not to mention heart disease. When 1 in 6 children are obese by the time they finish primary school and 1 in 4 children with obesity are estimated to have fatty liver disease, this government has sat on a ticking time bomb for the last 14 years without taking action. Labour is committed to ensure that all children get a healthy start to life, with free primary school breakfast clubs serving healthy food, an active and balanced curriculum and a pre-watershed ban on advertising junk food. So can the Minister confirm that concrete prevention policies to tackle the obesity epidemic will be included in the prevention strategy? And will she finally publish the consultation on the junk food ban and get on with legislating it? When mortality rates from liver disease are now 4 times higher in our most deprived communities compared to our most affluent, it makes a mockery of the government's rhetoric on tackling health inequalities and levelling up. To build an NHS fit for the future, Labour is committed to hitting all NHS cancer waiting time and early diagnostic targets within 5 years, and we will drive a prevention revolution with measures to tackle alcohol harms and the obesity epidemic, banning junk food ads to children, boosting capacity in local public health teams, and recruiting thousands of mental health staff to give more people access to treatment before they reach crisis. And as part of our 10-year health mission, we will improve healthy life expectancy for all and halve the gap in healthy life expectancy between different regions of England. Thank you.
Andrew Edson.
Thank you, Mr. Chope. It's a pleasure to serve under your chairmanship, and I have to say I'm a bit disappointed because I think particularly the Honourable Lady opposite knows very well my personal commitment to the Best Start for Life. So to hear her saying that the government's done nothing and Labour's going to fix it is a bit rich, Mr. Chope, but there we are. I do congratulate the Honourable members for Stockport and Glasgow Central for securing this important debate. It is an absolutely vital debate, and I know all Honourable members, including the members for East Renfrewshire and Sunderland, have raised the importance of prevention and early intervention, and in particular early diagnosis, and I commend them all for doing that. What I would say, however, is that the government is taking significant steps. The Honourable Lady for Glasgow talks about what the Scottish Government's doing. I can absolutely assure her that the government here in the United Kingdom is totally committed to improving early diagnosis and treatment, and I will go on to explain exactly what we're doing. But first, Mr. Chope, I think it's important to set out the fact that we know there are 6,000 new cases of liver cancer each year, making it the 18th most common cancer, with 5,000 deaths a year. That's 5,000 deaths too many. And as my right honourable friend, the member for Bromsgrove, said during his tenure as Health Secretary, regional inequalities are the disease of disparity, and he was absolutely right. Because as the Honourable Member for Stockport raised in his opening speech, economic and health inequalities go hand in hand. And Mr Chope, Blackpool is a perfect example of that, one of the most deprived cities in England that flashes red on every indicator for life expectancy, alcohol dependency and liver cancer, where no fewer than 40% of the people who are unemployed there are not fit to work due to ill health. And the rate of death from chronic liver disease is almost 2.5 times the average for England. And that's an area where I have visited a number of times to visit their family hubs and to look at the excellent work, the huge efforts that go on there to try to level up, to improve the disparities. But nevertheless, there is so much more to be done. And our strategy to eliminate disparities in liver disease and liver cancer are based on 2 key facts. First, that 90% of liver diseases are caused by alcohol dependency, obesity, or viral hepatitis. And second, that the 5-year survival rate for liver cancer is only 13%, precisely because people don't come forward with their symptoms until it's too late. So early detection is vital. We know what causes liver disease, and we know diagnosing it more quickly will save thousands of lives. That's why prevention and diagnosis are the twin pillars of our strategy to end inequalities in liver disease and liver cancer across our country. So, Mr Chope, just to be clear, this is not about criticising people for drinking alcohol. This is about stopping the level of drinking that leads to liver disease and liver cancer. And we know that rates of alcohol dependency are double that in the most deprived local authorities, which is why in December 21, we published our drug strategy, which does 3 things. First, it has brought the greatest ever increase in funding for drug and alcohol treatment, with £780 million of extra funding, over £500 million of which is going straight to local authorities with the highest levels of deprivation and alcohol dependence. Second, the strategy is boosting screening capacity for liver disease. And third, it is beefing up referral pathways to build a seamless system from diagnosis to treatment. Since we published our strategy, we're treating more people than ever before for alcohol use. In February, almost 135,000 people were receiving treatment, compared to just over 117,000 just under 2 years ago, which is an increase of more than 15%. NHS England is investing almost £30 million to bring specialist alcohol care teams to hospitals in the most deprived parts of England. These experts in addiction identify people in hospital with alcohol dependence, start their treatment, and refer them to local authority community services where they can complete treatment, overcome their dependence, and move forward with their lives. And I do want to pay tribute to all those brilliant clinicians who are helping vulnerable people to turn their lives around. Mr Chope, obesity is another major risk factor for liver disease and is a real scourge on the poorest parts of our country. Now, during last week's debate on the tobacco and vapes bill, we came under fire, on all sides of the House actually, from some people who said, well, what about sugar? Are you going to ban that too? Well, this government is not in the habit of banning things, Mr Chope, but I am proud of our record on sugar reduction, healthy eating and obesity. We've made strong progress in reducing the average sugar content in soft drinks through the soft drinks levy. Between 2015 and 2019, we almost halved the sugar content in soft drinks. And I do want to make the point to honourable members that actually that's not with people saying, oh, this drink I used to like, I don't like it anymore because it's not sweet enough. That was actually reformulation that nobody noticed. And that's the great thing about reformulation. If we can reduce the sugar, salt and fat content in foods, and yet people can carry on as normal without having to sort of undertake some punishment routine, I think that is a very good way to reduce the sugar content in food and therefore to tackle the obesity problem. Yes, I will.
Having people's attention to the sugar tax
and when it was brought in, there was a particular exemption in that product, and in the products that were put for reformulation. And those were milkshakes, which could contain as much sugar as any of the full-fat fizzy drinks, so to speak, but were somehow exempted because they had milk in them. Would you take the opportunity perhaps to go away and think about whether they ought to be contained within a future iteration of the scheme?
Well, what I can say to the Honourable Lady, as she will not be surprised because she knows me well, I am absolutely determined to tackle, in particular, childhood obesity, to try to ensure that we can reverse the problems that we've seen in recent years, and particularly during the COVID pandemic, where we've seen a spike in unhealthy eating, overeating. We know that people, adults and children, are just consuming too many calories. As she would expect, I am all over this, and I'm very happy to debate with her on any points. But yes, I agree, the sugar content in milkshakes, but there are so many other foods as well that we need to really focus on. And I hope I can reassure her there. Now, for 2 years, we've been restricting the placement of less healthy products in shops and online, helping consumers to make healthier choices. And we are building on this progress. By the end of next year, further restrictions on price promotions on television and 3 for the price of 2 offers in shops will come into force. And what I've been doing with the big takeaway companies, the big supermarkets and so on, is trying to encourage them to do it anyway, to get ahead of the regulations, to take action now. And a number of them, I'm pleased to say, are doing just that. I'm also pleased to update the House on the recent success of the NHS Digital Weight Management Programme. This week, the Obesity Journal published a study showing almost 32,000 people achieved sustained weight loss with the programme over the course of a single year. That's really positive news. The programme is helping people from deprived backgrounds, with more than a third of the referrals from Black, Asian and minority ethnic communities. So obviously early days, but I think very positive signs. And then the other major contributor to liver disease, Mr. Chope, is hepatitis. And thanks to increased testing and improved access to treatment, we have reduced the number of people living with chronic hepatitis C virus in England by more than half since 2015. And deaths related to hepatitis C have fallen by just over a third since 2015, well above the World Health Organization's 10% target. Mr. Chope, liver disease is known as the silent killer because so many people are unaware of their condition until it's too late. That's why, as part of our ambition to detect 75% of cancers at an early stage by 2028, NHS England has launched the Early Diagnosis Programme for liver cancer, a programme which aims to prevent liver cancer by actively checking for liver disease in our most deprived areas. An important part of the early diagnosis programme includes 19 community liver health check pilot sites that were launched in 2022. And the most recent data shows that between June 22 and January 23, using mobile units, the CLHC, I won't say it again, programme reached over 7,000 people in our most deprived areas. These units are equipped with fibroscans, which is a fantastic new technology, as many honourable members have mentioned, for detecting liver damage, and it identifies liver disease before it becomes life-threatening. These non-invasive tests have diagnosed over 830 patients with cirrhosis or advanced fibrosis. And I'm pleased to update the House that there are now 8 community diagnostic centres providing fibroscan and a further 14 planned. So, Mr. Chope, fairness and equal opportunity are principles I have fought for my entire career, from helping children and babies in deprived areas to get the best start for life, to levelling the playing field for small businesses when I was Secretary of State for Bays, to encouraging young women in my constituency to get into politics. I have done this throughout my career and I will not stop now. I'm passionate about making our health service faster, simpler and fairer for all who use it. And tackling liver disease and liver cancer is absolutely at the heart of that mission. We have already delivered significant progress, and through prioritising prevention and driving early diagnosis, we have a plan to go further and faster in the years ahead. Thank you.
Independent Minister.
Thank you, Sir Christopher. I'll just end on a few remarks. I'd want to thank everyone who has contributed in this debate, front bench and back bench. I'm a bit surprised that we don't have any speakers other than the Minister from the government benches. I would have thought that this is an important issue that needs to be debated. But nonetheless, I'd just like to end on a few points that the rate of hospital admissions for liver disease is higher in deprived areas. In 2021-2022, there were 211.4 hospital admissions for every 100,000 people living in areas of multiple deprivation, compared to 125.1 in the least marginalised areas. So this is quite serious. I echo the point, one of the points that I agree with on the Minister when it comes to alcohol consumption is, I mean, Alcohol Change UK make this point themselves, that they are not anti-alcohol, they are against alcohol harm. So they're anti-alcohol harm, they're not against the consumption of alcohol. And can I just leave the Minister with a few questions? And to be honest with you, on a personal note, whenever I've gone to her with various issues, she's been extremely helpful and tried to do her best. But I think this is an important issue for the broader government and the Department for Health. I urge the Minister to take urgent action to improve earlier detection and outcomes for liver cancer and the less survivable cancers. This is critical that the government delivers on its pledge to diagnose 75% of all cancers at an early stage by 2030, I have down, but I think she mentioned 2028, I think, so that's even better. The Minister must commit to delivering a cross-government strategy to curb health inequalities and a prompt comprehensive review of adult liver services by NHS England to reduce the staggering health inequalities we still face. We also need a comprehensive cross-government alcohol strategy that tackles the social and commercial determinants of health. I would also like to ask the Minister what assessment, if any, the Department has made of the inequalities impact of funding cuts to alcohol treatment services. So these are very, very serious issues, and I thank the Shadow Minister for her contribution, and I hope to work with the government on this. And once again, my last point being, thank you to all the charities and campaign groups that do so much on this issue. Thank you.
The question is that this House has considered health inequalities in liver disease and liver cancer. As many have been say aye. Aye. Contrary no. I think the ayes have it. The ayes have it. Order, order. The sitting is suspended until 2 p.m.